Cervical cancer is the 13th most frequent cancer in women in Australia and the 4th most frequent among women aged 15 to 44 years. Currently, there are approximately 9.81 million women aged 15 or older at risk of cervical cancer, with 793 diagnosed each year. However, in underdeveloped regions, cervical cancer is the second most common cancer in women. In fact, of the 270,000 women who died from cervical cancer in 2012, 85% from low to middle income countries.
So, what causes cervical cancer? Cervical cancer is caused by human papillomavirus strains 16 and 18. The virus is able to infect the basal layer of the epithelium and can then integrate into the host cell genome. The expression of viral genes and resulting products are able to deregulate host cell growth by binding and inactivating tumour suppressor proteins. An example is the E6 gene of HPV, which can bind tumour suppressor protein P53 and target it for rapid ubiquitin-mediated degradation. This disrupts the normal function of P53 and allows cell proliferation to continue unchecked, without the ability to induct the apoptotic pathways in abnormal cells. The E2, E1 and E4 gene products play a role in viral replication, virion maturation and release, which can result in the progression of cervical cancer.
Jane Doe lives in an underdeveloped country where there are high rates of HPV infection. Jane has also been exposed to tobacco use, has a weak immune system, and has had first sexual intercourse at an early age. Unfortunately, Jane has become infected with HPV and is currently experiencing menstrual bleeding that is longer and heavier than usual. There is also vaginal bleeding both between her menstrual periods and after sexual intercourse, as well as abnormal and increased vaginal discharge and persistent pelvic pain. Jane goes to see a healthcare professional who conducts a pap smear test. This is a manual procedure where samples of cervical cells are swabbed and analysed microscopically to detect any precancerous changes. From the pap smear, Jane was diagnosed with invasive cervical cancer. Fortunately, there are treatments available and Jane undergoes radiotherapy, which can destroy the cancer cells or stop them from growing. Screening services, including pap smears and the cervical screening test, are also available. However, while pap smears look for cell changes in the cervix, cervical screening tests can detect HPV infection in the cells themselves. Pap smear testing and subsequent follow-up in developing countries has decreased cervical cancer-associated mortality by 50 to 70%. However, the cervical screening test allows for more accurate testing and replaced the pap smear in Australia in 2017. Vaccines are also available to prevent against HPV infection. The Gardasil vaccine protects against all the HPV types that cause around 90% of cervical cancers. However, it does not protect against all types. Therefore, cervical screening is still required for those aged 25 to 74 years. Nonetheless, this allows for earlier detection of cancerous lesions and thus earlier treatment intervention and improved patient outcomes.
A positive ending to this story about cervical